As an orthopedic surgeon and specialist in sports medicine, my primary interests are in managing active patients who have problems of the shoulder, elbow, and knee. Over the last 20 years, we've garnered significant knowledge in terms of how to treat patients with non-surgical means, ways to modify their symptoms, maybe even modify their disease. It can be biochemical, it could be pharmacologic, it could be physical in terms of rehabilitation, it can be diet, it can be the use of various injections and so forth that can modify the way a patient feels even without surgery. Much of our clinical emphasis, our treatment emphasis, has been on providing alternatives to joint replacement in an area of research called cartilage restoration. We at Rush have pioneered procedures that allow them to stay active without concerns for compromising their implant. So for example, when a patient is too young, they're really not good candidates for a replacement because the life of that replacement will be shorter than the number of years they have remaining to be active. So the procedures that we have are bridge building procedures. So that's meniscal transplants, that's cartilage transplants, that's cell transplants. And we now combine these in an evolutionary way with procedures that involve regenerative medicine techniques and biologics that shorten healing times and improve healing rates. When a patient comes back and says, you know what, I had so much anxiety, so much fear, I thought I would never return to the activities that I once had. And because of what your team did with me, I now can do everything without pain and with full function. I never thought that would happen. Thank you. When that happens, that's a priceless moment. Sort of everything else around that, all the issues that we deal with in our daily lives, sort of temporarily evaporate, and the entire focus is on that relationship with the patient where they achieve the goal that they never thought it was possible.